Hey, so I got a question from a therapist asking about post-tendon repair. Why does stiffness set in so fast after joint mobilizations, whether it's passive or active? My name is Huang. I'm an occupational therapist and certified hand therapist. And my goal at Hand Therapy Secrets is to help occupational therapists develop their clinical skills and business skills. And if you have questions, then I'm going to be answering them through this series of Ask Me Anything questions. I'm going to answer them for you and tell you my perspective. So, this question is about post op tendon repair. I don't know about you, but my patients ask me the same exact question all the time. Why do when I wake up, it feels so stiff? Why do when I do my exercises and afterwards, it gets so stiff? So, regardless of whether you do passive range of motion or active range of motion, why does the stiffness set in after a period of time, let's say within 3 hours or so? So, in order to understand why the stiffness sets in, you have to understand the nature of injuries and the nature of surgery. So, anytime you have an injury, your body like sends, like I always say, it sends the construction workers to come in and repair it, right? And then when you have the surgery to repair the broken tendon or any broken structures, let's talk specifically about tendons have to be repaired, right? So if we're talking about flexor tendons or we're talking about extensor tendons, the muscle starts out here, ends in here. When you cut it, the muscle retracts back, right? So it retracts back and it has to be sewn down together so that it can reattach and then do its job of being able to cross the joint and move the joint. Let's talk about flexor tendon. So in order for flexor tendons to work, there's all these other structures that also support and surround those flexor tendons to allow it to fully work. So when there's a cut and there's an injury, and then on top of that, there's a surgery, you have to almost think about it as if you have two injuries, right? First from the injury itself, and second from the surgery itself. And that requires your body to send these extra cells to come down there and to heal. And in its healing process, it creates edema, it creates scar tissue. So if you study the nature of scar tissue, the fibers of scarring are like jumbled up. If you think about like um, dropping a box of spaghetti noodles and then you're like jumbling it up together, and it's all, instead of laying like in fine lines, it's all meshed together, right? And so it's through stress, right? It's through continuous stress that those fibers start to like get realigned. So you try to realign it and then it gets bunched up again, and it gets realigned through movement and it gets bunched up again. So that's why stiffness sets in so fast, no matter if you're doing joint mobilizations, if you're doing scar, you're working on edema, you're working on passive range of motion. That's why the therapy process takes a while. So the injury doesn't take a long time, but your body's ability to, one, heal itself, but two, the outside surgery to also support that healing is what's going to help someone be able to get more motion. And stiffness just sets in really, really fast because of the nature of the injury. The body is constantly sending its construction workers, it's sending those cells to that area to then scar down and heal. So as long as you're continually stressing it, it's sending those cells to continue to heal it. And after a certain amount of time, it starts to dissipate. It starts to not send so much. And then the fibers that are there start to get realigned and realigned. So one thing that I always teach my therapists, my students, my patients themselves is, when we're as therapists, when we're working with someone, we're not just looking at quantity of movement, right? Quantity of movement is how much range of motion they have. We're also looking at quality of movement, right? So quality of movement is something like, how long does your stiffness, um, like how long does your looseness last for, right? So if you passively move someone at the beginning stages of them working with you in the first 2 weeks, 4 weeks, it's going to take, their looseness will last only 30 minutes. But after about a month or 2 months, their stiffness will their looseness will last even longer. It's going to last for hours, and then as they continually get better, their looseness will last for days, right? The other quality of movement instead of quantity is, you know how you're working with someone and it takes you all hour to loosen them up, right? It takes all hour. You're like, dear Lord, this finger is going to take me forever. Well, as you progress, one way to measure how they're progressing through the quality is you'll get the looseness faster. So where it might take you an hour the first, couple of times, or the first 2 weeks or 3 weeks, with as they get better, it will only take 30 minutes to get loosened up, and then it'll only take 15 minutes to get loosened up, right? So you're looking for quantity, which is the amount of movement, and then you're looking for quality, which is things like how fast does someone loosen up, how long do they stay loose, things like that. And then the quality of their movement. So the quality of their movement is between active and passive, right? So at first, they can only get so much passive, right? Only so much passive. And the quality that you're looking for is, wow, they're getting all their passive range of motion in a shorter period of time. Let me know if that makes sense. And if that makes sense to you, what I'm describing, leave me a comment below and let me know, like, this totally makes sense, right? If it doesn't make sense, please also leave me a comment to let me know, like, what your follow-up question is, and maybe your question will be the next video that I make. Okay. So if you're looking at quantity, if you're looking at quality of how much passive they have, you can also then look at quality of active, right? So at first, it might just be like it's such a real struggle to get that amount of active range of motion. And then after a while, they're like, oh, this part is good, but I can't get the very end part. And injuries itself is a process. Recovery, sorry, not injury. Injury is really fast. Recovery is a process that is required, it's demanded. We cannot take a magic pill and all of a sudden, poof, your stiffness is gone. And I think that most people are looking for that. Most people who come to me, they're like, if I take this anti-inflammatory pill, will this help me? And my answer to them, this is exactly what I tell my patients, is when you take an anti-inflammatory pill, it has to go into your stomach, and then it has to get digested through your system, and then it sends it to the whole entire body, right? But you have inflammation here. You know what I'm saying? Like in that one finger. It's always the middle finger. But so it takes a while to get there. The way you reduce inflammation to the one target area is through movement, right? When you move, right? When you move, you're using muscles to push the fluid out. Now, in the hands, it's not that simple because we don't have big muscles in the hand. We have small little itty bitty muscles, and then those muscles have small itty bitty tendons. And so things get really stuck in the hand really fast. If you have ever studied the PIP, we have so many structures of like little strands of tendons here and here and here, all around just that one joint. We have such small strands of structures. They're so small, they're so delicate, yet extremely strong, right? And so it is one of the reasons that causes stiffness, especially in the PIP. Especially in the PIP, we have what's called collateral ligaments. And those collateral ligaments, they're tight all the time. So they're tight when the finger goes into flexion, and they're also tight when the finger goes into extension, that particular joint. So because the collateral ligaments are always so tight to give that joint such stability, in an injury, it's giving it such stability that it gets really stiff. So that's, it's just understanding the nature of the injury and the nature of the structures that's going to help you understand and explain why stiffness sits there for so long, right? Um, and I think when you study that and you understand that, it makes everything so much easier. There's a couple of other reasons, but when you understand the nature of the injury, you understand the nature of the tissues, it can help you understand what to do and how to do it better, and then apply your manual therapy techniques. Pick the best exercise to do in the order in which you're supposed to do it. I tell my patients all the time, if we're doing an exercise and it doesn't help, it's because it's not that that exercise didn't work. It could be that the exercise is in the wrong order, or it could be that we're not carrying that exercise out well enough. And so you're not seeing the results. So there's, in any kind of injury, right? In any kind of injury, it really does come down to a little technical, critical thinking, and then technical skills. To really help get rid of that stiffness. But stiffness lasts for a really long time. And the other reason why stiffness lasts for a really long time is because edema, swelling lasts for a long time. And it could take, 6, 9, 12 months to fully get rid of. Like, you'll see it dissipate over time, but to fully get rid of something, it's going to take a year. Like, it can take up to a year. So setting that expectation is really important. Can you make progress in the whole time? Absolutely. Do you need to be in therapy the whole entire time? You don't. You don't need to be in therapy for a year. You don't need to be, but there is a magic window of opportunity for therapy that needs to be consistent, and it needs to be early, and it needs to be aggressive, aggressive meaning like that you're making progress. And then you can have what in my clinic we call tune-ups. Like, we can follow up every once in a while, so that we get you to your goal of hitting 100%. Doesn't mean you have to be in therapy the whole time. It just means that, you need some help, to understand it. So I hope my answer helped you to consider what is going on with your patients, why they have such stiffness, and then, of course, to be able to take what I'm explaining, and then you, as a hand therapist, you as an occupational therapist, you can go and explain that to your patients so they can know that you know what's going on, right? Because I promise, people are looking for someone to trust, and I think that as an occupational therapist, as a hand therapist, as a certified hand therapist, I think that you have a lot of possibility to help people with injuries, to help people after surgery, and especially tendon repairs are so tough. They're tough on the patients, they're tough on the therapists, because we want to do such a good job for our patients. But understanding the nature of the tendon, of the injury, of the surgery is so important. If you found this question and this answer helpful, and you have any other questions, definitely drop them below, because I'm answering your questions through a series I'm doing so that it can help more and more therapists in hand therapy. And I want to help you develop your clinical skills. So let me know if this helps you. I am going to also include some videos up here that can share with you some other tendon types of videos that can help you with your cases. And then also, don't forget, until next time, like and subscribe the videos. All right, I'll see you later.